Now doctor, people, they usually go to the doctor complaining of a chest pain and they say, look doctor, I have a chest pain, it's been hurting for a long time. And then the doctor usually says, okay, you have angina, stable angina, and then he might say it's unstable angina, and at the end the patient is really confused because he went with a chest pain and got diagnosed with angina. And in general, a general person cannot understand this word. It's a technical medical jargon, so obviously a normal heart patient can't understand the word angina. Doctor, can you explain what the meaning of angina is and what stable and unstable means to a patient?
Yes. See, in medical practice, something is called a symptom and something is called a sign. Symptom is what the patient come up with. I mean, the patient can say, they may not be able to say it's a chest pain. They may say, I have a pain in my neck, I can have a pain in my jaw, I have some pain in my hand which I couldn't explain. Or they may say it's kind of a pressure. They may say, no, I never had pain doctor, it is a kind of pressure which comes when I walk. So these are all the terminology which the patient use. And what as a physician we do is, we look for sign. Then what we do is angina. When you say angina, angina is a terminology to explain the cause for your all your symptoms, the different things you presented. It's because of the lack of blood flow to the heart muscle. So once we know that the pain which you have been characteristically you are saying in a different way, it's actually is cardiac, then we will took the terminology angina. So angina is saying that your pain or whatever way you are expressed it probably or most likely because of the reduction in the blood flow to your heart muscle. So if there is a reduction in blood flow to the heart muscle, most probably 90% it is because the blood vessel which is carrying the blood to the heart muscle has a stenosis or an obstruction. So it is not able to deliver the blood flow normally. So there is a reduced amount of blood is going to the heart muscle, and the heart muscle is not happy because it's getting only with less nutrition, less oxygen. So it is a way of the heart telling you, look, I'm not getting enough supply, and it is trying to tell you by creating a pain. That pain is called, as a patient it's a chest pain, discomfort all. As a physician we term it as angina. Now you brought up a very important point when you just you asked me a question. You talk about stable and unstable. Well, stable, unstable, it looks like a very similar terminology. It's a very small u and un, stable and unstable, but it make quite a lot of difference for a cardiologist. And I think today I would like to try to give you an answer to say how a patient should also be able to understand the difference between stable and unstable. Why I am stressing it again and again is the management of stable and unstable are wide apart. In the sense, one is a highly interventional, one can be managed conservatively. So once you can understand, the cardiologist has to identify a diagnosis whether it is a stable or unstable. Well, let me put it in a simple way. If a patient goes to the cardiologist clinic in an outpatient setup and he was asking about his chest pain or angina and wants to know about stable or unstable, the first thing I want to say is, because you have gone to the clinic, waited in his waiting hall and finally took a time to meet him, then you are stable. And if you are unstable, probably you may not be waiting in the clinic. You might be saying like, my pain is too much, I have to go to a hospital, and you could have admitted yourself. So that's a simple way. We call stable means patient walking. So he came vertically to your clinic, and unstable means horizontal. So this guy have to go in a stretcher. So that's a simple way. Now let me put it in a simple terms to understand the stable unstable. Now stable angina means patient have angina or chest pain, which is usually come when he do some exertion. Like usually he says, doctor, when I start doing my regular activities which I used to do always, I got a kind of a discomfort in my chest region or a pain. And then they may say it subsides, and also sometime when I get very emotional and I shout at my people in my office or my home, I get some discomfort. Or they may say it's like climbing staircase. I usually climb my staircase every day in my office, two stairs or 2 flights, 3 flights, but now I am finding it difficult to do that. So it all happens when there is an exertion. So when the exertion there is a pain, and the pain gets relieved at rest. They say like I just stop doing things what I am doing, then my pain is gone. It's only for 2 to 3 minutes, doctor. And then the another one is nitrate. Some people have been taught by the doctor, when you get this type of pain, you take a sorbitrate under your tongue. The sorbitrate is a medicine which can dilate your vessel. Once the vessels are dilated, the blood flow is restored back to normal. So the pain immediately goes off. So this is called stable anginal patient. So they get chest pain often and often, and these are all the patients who come to the outpatient clinic complaining to the doctors, doctor, I am getting chest pain, you give me some medicine, you give me some pills, I have taken it, but still I am having chest pain, I am worried, I am afraid, I am going to get a heart attack. This is called stable. Now let me go to another group called unstable. So this is the same condition, but the pain which will subside in 2 minutes in the stable patient will not subside even after 30 minutes or 40 minutes. The patient said, I got a pain, I tried whatever I could, I stopped doing what I am doing, I took some sorbitrate, I rested myself, I took some water, Gelisil, whatever I take, the pain didn't subside. And also they give a typical history, doctor, usually you told me I have a stable angina, I had like same type for the past 6 months, but the past 1 or 2 weeks or 3 weeks or past 1.5 months, the symptom is getting aggravated. Usually the pain goes off in 2 minutes, it's lasting for half an hour. Usually comes once or twice in a day, it is coming like 10 times to 15 times a day. So now this is called unstable. So once a pain is severe, the patient themselves realize that something is wrong, and they immediately go to the hospital, not to your clinic waiting in your waiting room and trying to meet you. So that's the way difference between stable and unstable. Now the next question, like, why do I have to know whether I have stable and unstable angina? Is it so important for me? I mean, my doctor is going to look at me and do whatever it is required. Well, I think it makes a lot of difference. Now all the trials, that's why we spoke about the Orbiter trial. Now what I want to tell you is, if you are a stable patient and if you are in a conservative medical management, I believe you have to stay on the medical management, because your risk of any other adverse event, death or decrease in your survival, or afraid to go for a angioplasty or bypass surgeries are very low. So if you want to defer an interventional procedure, I think you are very safe to defer an interventional procedure and stay with medical management. Now unstable angina is a condition where your heart is giving you a very strong signal. Look, I mean, I am telling you many times, but you are not listening. Now I am giving you a pain which is going to be like more than half an hour. So it is actually it is a signal for an impending heart attack. You don't address it properly, you don't go to the hospital, get admitted and do some interventional procedure to immediately open the vessel, then probably you might get a heart attack, and the complication of heart attack is so many. It may get an arrhythmia, or it may get a death. So I think when you are unstable angina, intervention plays a very major role in saving your life, or prolonging your life, or preventing a heart attack. But in stable anginal patient, you are far more better off with the drugs than rushing yourself into an angioplasty or a bypass surgery. Now the only problem lies here is, when a patient has been diagnosed as unstable but actually is stable and going for all the interventional procedure, it is a waste of so much of resource for the insurance, for the country, for the family, because I know in India insurance is only 9% of the population is covered by insurance. So I am not about Sri Lanka. So when you put a financial constraint to these group of patients without any benefit in mortality or morbidity, I think it carries a lot of risk for the society. So identifying stable to unstable is very important, and right now in many places there are 5 lakh angioplasty procedures are done for stable patients, which is not required. So I think it's a paramount important for the listeners as well as all the physicians to know between unstable and stable, and make sure your diagnosis is very, very clear, and make sure the investigation and or interventional procedures are mostly should be recommended only in the unstable, not in the stable.
Okay. So doctor, what you're saying is simply patients with stable angina, they don't really need angioplasty, but they can go on conservative medical management taking normal medicines. But unstable patients, they directly have to go and do a bypass surgery or angioplasty.
Yes.
Okay.
You're absolutely right, because simply when a patient, I mean we are seeing a lot of patients, thousands of patients, the first or only question in the mind is, doctor, you said to stay with medical management, but I'm afraid. Am I going to be exposed to more risk of death just because I'm deferring an interventional procedure? Now this trial which we just spoke about, and I'm going to add up a couple of other trials which clearly shows in stable anginal patient, deferring an interventional procedure, still you are not exposed to undue risk of a death or a heart attack or an urgent requirement for a bypass or angioplasty.
Okay, so stable patients don't need all of this because they are not under risk.
Still conservative should be managed on conservative rather.
They can go on medical management. Okay, doctor. So doctor, this conclusion that you just said, it seems essential when managing patients with heart disease. I am really sure that our Tamil community would appreciate knowing such a valuable piece of information. Can you please explain this in Tamil?
அதாவது இந்த இப்போ அவங்க கேட்டிருக்க கேள்வி என்னன்னா, ஸ்டேபிள் அன்ஸ்டேபிள்னு ஒரு ரெண்டு இருக்குது. அதாவது நம்ம ட்ரீட்மெண்ட் பண்ணும்பொழுது வந்து ஒரு எல்லா இருதய நோயாளியும் வந்து அவருக்கு இருக்கிறது வந்து ஸ்டேபிளா இல்லைனா அன்ஸ்டேபிளான்றதை வந்து புரிஞ்சுக்கணும். அது மட்டும் இல்லாமல் அதற்குடைய அனைத்து இன்ஃபர்மேஷனும் அந்த பேஷண்ட்டுக்கு வந்து ஒரு டாக்டர் கொடுத்தே ஆக வேண்டும். அப்படி கொடுக்கப்படவில்லை என்றாலும் ஒரு பேஷண்ட்டு வந்து இதை முன்னாடியே தெரிஞ்சு வச்சுருக்கணும். அப்படி தெரிஞ்சு வச்சிருக்கிறது மூலம் வந்து அந்த பேஷண்ட்டே வந்து ஒரு கம்ஃபர்டபுளாக வந்து ஒரு பைபாஸ் ஆஞ்சியோபிளாஸ்டியை வந்து அவாய்ட் பண்ணலாம். அதாவது அந்த இன்ஃபர்மேஷன் என்னென்னா, அதாவது வந்து ரெண்டு வகையான நெஞ்சு வலியை வந்து ரெண்டு வகைப்படுத்துகிறாங்க. ஒன்று வந்து ஸ்டேபிள்னும் இன்னொன்று வந்து அன்ஸ்டேபிளும் என்று இரண்டு வகைப்படுத்துகிறாங்க. இப்போ நீங்கள் வந்து ஸ்டேபிளா அன்ஸ்டேபிளான்றதை வந்து நீங்கள் முதல்ல புரிஞ்சுக்கணும். அதாவது வந்து இப்போ நீங்கள் ஒரு நெஞ்சு வலின்ற பேஷண்ட் வந்து ஒரு கிளினிக்கு போய் ஒரு டாக்டரை பார்க்குறீங்க. அந்த டாக்டரை பார்த்து வந்து எனக்கு வந்து நெஞ்சு வலின்னு சொல்கிறீங்க. அப்படி இருக்கும் பட்சத்தில் வந்து உங்களால் வந்து ஒரு கிளினிக்கு போய் வெயிட் பண்ணி அந்த டாக்டரை பார்த்து நெஞ்சு வலின்னு சொல்ல முடிஞ்சிருமானால் நீங்கள் வந்து ஸ்டேபிள்னு அர்த்தம். இந்த ஸ்டேபிள் பேஷண்ட்டுக்கு என்னெல்லாம் சிம்டம் இருக்குன்னா, யூஸ்வலாக வந்து டாக்டர் முன்னாடிலாம் எனக்கு வந்து நெஞ்சு வலினா என்னன்னே தெரியாது, ஆனால் இப்போ வந்து ஒரு 10 நிமிஷமோ 20 நிமிஷமோ ஒரு 25 நிமிஷமோ நடந்தால் வந்து டப்புன்னு ஒரு வலி மாதிரி வருது நெஞ்சில். ஆனால் வந்து நின்றுட்டேன்னா அந்த வலி போயிடுது. அதே நேரத்தில் வந்து கொஞ்சம் எமோஷ்னலாக ஸ்ட்ரெஸ் டென்ஷன் ஆகிட்டு ஆஃபீஸில் கத்துனாலோ வீட்டில் ஏதாவது பிரச்சனைனாலோ எனக்கு மைல்டாக ஒரு நெஞ்சு வலி மாதிரி வருது. அதுவும் வந்து ஒரு நிமிஷம் நின்றுட்டேன்னா சரியாயிடுது. ஸ்டார் கேஸு, நான் யூஸ்வலாக ஆஃபீஸுக்கு வந்து 3வது மாடி சார், 2வது மாடி, நான் எப்போ வேணாலும் நான் போயிட்டு வருவேன். ஆனால் இப்போ ஒரு 10-15 நாளாக வந்து என்னால் அது மாதிரி ஏற முடியல. ஏறினா வந்து ஒரு மாதிரி மூச்சு அடைக்கிற மாதிரி இருக்குது, மூச்சு வாங்குது. இதெல்லாம் வந்து சிம்டம் வந்து ஹார்ட் டிசீஸுக்கான சிம்டம். இதை ஏன் நம்ம ஸ்டேபிள்னு சொல்கிறோன்னா, நீங்கள் நின்று ஒரு 2-3 நிமிஷத்தில் இந்த வலி போயிடும். அப்படி இல்லைனா நாக்கு கடியில் மாத்திரையை வச்சிங்கனாலும் அந்த வலி இமீடியட்டாக போயிடும். இல்லைனா ரெஸ்ட் எடுத்துகிட்டு மாத்திரையை வைக்கிறது, அப்படின்னு தான் வலி இமீடியட்டாக போயிடும். இதுதான் ஸ்டேபிள். இந்த ஸ்டேபிள் பேஷண்ட்டுக்கு வந்து மெடிசன், அதாவது மருந்து உட்கொள்கிறதே வந்து போதுமானது. அப்படியும் பெயின் கம்மியாகலைன்னா டெஃபினட்டாக வந்து பைபாஸு ஆஞ்சியோபிளாஸ்டி ட்ரீட்மெண்ட் இல்லாமலேயே இதை நம்மளால் குணப்படுத்த முடியும். இப்போ இன்னொரு மேஜர் கொஸ்டின் என்ன பேஷண்ட்டுக்கு, டாக்டர் நீங்கள் சொல்லிட்டீங்க பைபாஸ் ஆஞ்சியோபிளாஸ்டி வேண்டான்னு, ஆனால் எனக்கு பயமாக இருக்குது. இப்போ நான் பைபாஸையோ ஆஞ்சியோபிளாஸ்டியோ அவாய்ட் பண்ணுறதுனால வந்து எனக்கு ஃப்யூச்சரில் ஹார்ட் அட்டாக்கோ இல்லைனா என்னோடய டெத்தோ இல்லைனா திருப்பி வந்து எமர்ஜென்சியாக ஒரு பைபாஸ் பண்ணுற நிலைமைக்கு என்னை கொண்டு போய் விட்டுருமான்னு கேட்பாங்க. டெஃபினட்டாக ஸ்டேபிள் பேஷண்ட்டுக்கு அந்த சான்ஸ் வந்து ரொம்ப குறைவு. அப்படி நீங்கள் பைபாஸ் ஆஞ்சியோபிளாஸ்டி பண்ணாலும் அதனால் எந்த பிரயோஜனமும் உங்களுக்கு இருக்காது. அதே வேளையில் வந்து அன்ஸ்டேபிள்னால் என்னென்னா, இதே மாதிரி நெஞ்சு வலி, ஆனால் வந்து ஒரு 15 நிமிஷம் 20 நிமிஷம் 30 நிமிஷம் நெஞ்சு வலி இருந்துக்கிட்டே இருக்குது, நான் மாத்திரையை போட்டுட்டேன் நின்றுட்டேன், இருந்தாலும் அந்த நெஞ்சு வலி எனக்கு குணமாகவே இல்லை, முன்னாடியாவது வந்து ஒரு பாஸ்ட் ஒரு 3 மாதத்தில் வந்து வலி அதிகமாகிக்கிட்டே இருக்குது அப்படின்னு சொல்கிறது வந்து அன்ஸ்டேபிள். இந்த அன்ஸ்டேபிள் பேஷண்ட் வந்து எந்த டாக்டர்கிட்டையும் வந்து ஒரு கிளினிக்கில் போய் 3 மணி நேரம் உட்காந்து டாக்டரை பார்க்கறதுக்கு முடியாது. அவங்க இமீடியட்டாக ஹாஸ்பிட்டலில் போயிடுவாங்க நெஞ்சு வலி இருக்கிறது. அந்த அன்ஸ்டேபிள் பேஷண்ட்டு வந்து ஆஞ்சியோபிளாஸ்டியோ பைபாஸோ உங்கள் கார்டியாலஜிஸ்ட்டோ உங்கள் ஃபிசிஷியனோ அட்வைஸ் பண்ணாங்கன்னா பண்ணுறது ரொம்ப இம்பார்ட்டன்ட். ஏன்னா வந்து அன்ஸ்டேபிள் ஆஞ்சினான்னு சொல்லும் போது வந்து உங்கள் இருதயம் என்ன சொல்லுதுன்னா, ரத்த ஓட்டம் ரொம்ப கம்மியாக போயிட்டுருக்கு, அதனால் இம்மீடியட்டாக இதை நீ வந்து குணப்படுத்தலைன்னா உனக்கு ஹார்ட் அட்டாக்கோ இல்லைனா டெத்தோ ஏற்படலாம் அப்படின்னு அந்த வலி வந்து அதைத்தான் உணர்த்துது. ஸோ அப்படி இருக்கும் பட்சத்தில் வந்து ஒரு பைபாஸ் சர்ஜியோ ஆஞ்சியோபிளாஸ்டியோ பண்ணுறது வந்து டெஃபினட்டான ஒரு ட்ரீட்மெண்ட். அங்கே போய் நம்ம அவாய்ட் பண்ணுறதுக்கான சான்ஸை தயவு செய்து வந்து பண்ணாதீங்க. ஸோ ஸ்டேபிள் அன்ஸ்டேபிள் இது ரெண்டுத்துக்கும் வந்து ட்ரீட்மெண்ட் கம்ப்ளீட்லியாக டிஃப்ரெண்ட். ஆனால் என்ன பிரச்சனைனா உலகம் முழுவதும் எவ்ரி இயர் ஒவ்வொரு வருடமும் 5 லட்சம் பேர் வந்து ஆஞ்சியோபிளாஸ்டி பண்ணுறாங்க. ஆனால் அவங்க ஸ்டேபிள். ஸோ தேவைப்படாமல் இருக்கும் பட்சத்துலேயும் அவங்க ஆஞ்சியோபிளாஸ்டி பண்ணுறாங்க. இதைத்தான் அவாய்ட் பண்ணணும். ஏன்னா வந்து ஒரு கண்ட்ரி முன்னேறணும்னா நம்பர் 1 எக்கானமி, இன்சூரன்ஸு, இது எல்லாத்துக்குமே ஸ்ட்ரெயின். ஒரு ஃபேமிலிக்கு ஸ்ட்ரெயின், இன்சூரன்ஸ் கம்பெனிக்கு ஸ்ட்ரெயின், அது மட்டும் இல்லாமல் ஒரு ஃபைனான்ஷியல் ஸ்ட்ரெயின். இவ்வளவும் வந்து ஒரு ராங் டயக்னோசிஸ் பண்ணி தேவையில்லாத ப்ரொசீஜரை வந்து ஒரு பேஷண்ட்டுக்கு பண்ணும்போது ஏற்படுகின்றது.
Dr. Shanta, it's now your turn. Can you please explain this extremely important piece of information to our Sinhalese viewers?
තෙනුරිය අහපු ප්‍රශ්නය සාමාන්‍යයෙන් රෝගියෙක් හෘද රෝග විශේෂඥයෙක් වෙත යන්නේ මගේ පපුවේ වේදනාවක් තියෙනවා කියලා. ඊට පස්සේ එතනින් ගිය ගමන්ම මේක අයිඩෙන්ටිෆයි වෙලා ඔබට ඇන්ජයිනල් කන්ඩිෂන් එකක් තියෙනවා කියලා ડોක්ටර්ගේ කටින් පිට වෙනවා. ඊට පස්සේ පේෂන්ට් බලනවා ඇන්ජයිනා. ඊට පස්සේ තව ටිකක් එහාට ගියන් පස්සේ මේක ඔයාලට තියෙන ස්ටේබල් ඇන්ජයිනා එහෙම නැත්නම් අන්ස්ටේබල් ඇන්ජයිනා මේ වගේ තවත් වෛද්‍ය ජාගන්ස් කීපයක් මේක ආපු ගමන්ම මේ රෝගීන් කන්ෆියුස් වෙනවා. එහෙම නැත්නම් තේරුම් ගන්න බැරි තත්ත්වයකටපත් වෙනවා. ඒතර තෙන් යහන්නේ මේක හරියට පැහැදිලි කරලා දෙන්න මේකේ තියෙන වැදගත්කම මොකක්ද කියන එක. ඒතර ડોક્ટર රාමසාමි මේ ගැන පැහැදිලිව විස්තර කරනවා. ਉਹ ප්‍රකාශ කරන්නේ මෙන්න මේ විදිහට. සරලව කිව්වොත් ਉਹ කියන්නේ ක්ලිනික් එකට ගිහිල්ලා කෙලින් හිටගෙන කියන්න පුළුවන් නම් මගේ පපුව සැරින් සැරේට විදෙනවා කියලා. ඒ රෝගියාට තියෙන්නේ ස්ථායි ඇන්ජයිනා කන්ඩිෂන් එක. එහෙම නැතුව පපුව රිදෙන්න අරගෙන හොරිසොන්ටලි ඒ කියන්නේ ස්ට්‍රෙචර් එක දාගෙන මට ඉක්මනට හොස්පිටල් එකට ඇඩ්මිට් වෙන්න ඕන නම් කියලා යම් රෝගියෙකුට දැනෙනවා නම් එයාට තියෙන්නේ අන්ස්ටේබල් ඇන්ජයිනා කන්ඩිෂන් එක. එතකොට මේක කොහොමද ක්‍රමානුකූලව සිද්ධ වෙන්නේ කියන එක ගැන දිගට ડોක්ටර් කතා කරනවා. ඒකෙදි මේක පැහැදිලිව Tamanට තියෙන්නේ ස්ථායි ඇන්ජයිනා ස්වභාවයක් කියන එක හැම රෝගියෙක්ම තේරුම් ගත යුතු විය යුතුමයි. ඒකට හේතුව ස්ටේබල් ඇන්ජයිනා එහෙම නැත්නම් ස්ථායි ඇන්ජයිනා තියෙන රෝගියෙක්ව ප්‍රතිකාර කරන විදියත් අන්ස්ටේබල් ඇන්ජයිනා එහෙම නැත්නම් අස්ථායි ඇන්ජයිනා තියෙන රෝගියෙකුට ප්‍රතිකාර කරන විදියත් එකිනෙකට සම්පූර්ණයෙන්ම වෙනස් වෙන දෙකක්. ඒ දෙක වෛද්‍යවරයෙක් හඳුනාගත්තයින් පස්සේ ඒ රෝගියා දිහා බලලා ඒ ප්‍රතිකාර කරන ක්‍රමය පැහැදිලිව තේරුම් අරගෙන ඒක කළ යුතුම වෙනවා. උදාහරණයක් විදිහට අපි හිතමු රෝගියෙක් යනවා තමාගේ හෘද රෝග විශේෂඥයෙකුට ගිහින් ඉවර වෙලා මට චෙස්ට් පේන් එනවා කියලා ડોක්ටර් කියන්නේ සයින්ස් කියන්නේ රෝග ලක්ෂණ කියන්නේ. එතකොට මේ රෝගය මොකද්ද කියලා කියන්නේ ડોක්ටර්. ඇන්ජයිනා ස්ටේබල් ඇන්ජයිනා අන්ස්ටේබල් ඇන්ජයිනා. අපි හිතමු මේ රෝගියාට තියෙන්නේ අන්ස්ටේබල් ඇන්ජයිනා කියලා ડોක්ටර් අඳුර ගන්නවා. ඒතර ડોක්ටර් අඳුර ගන්න දෙයක් නෑ මේක. මේකට ලෙඩාටම අඳුර ගන්න පුළුවන්. ලෙඩාටම අඳුර ගන්න පුළුවන් කියලා කියන්නේ ලෙඩාට දැනෙන පපුවේ සුළු වේදනාවක් තියෙනවා. මේ වේදනාව එන්නේ එක්ක පොඩ්ඩක් ඇවිද්දාම ඇඩිබල ඇවිද්දාම. එහෙම නැත්නම් පඩිපෙලක් නැග්ගහම. එහෙම නැත්නම් හිටපු ගමන් තරහ ගිය වෙලාව. දුක හිතන වෙලාව. මේ චෙස්ට් පේන් එක එනවනම්. එහෙම නැත්නම් ඩිස්කම්ෆර්ට් එක. පොඩි පපුවේ අපහසුතාවයක් එනවනම්. ආව විතරක් නෙමෙයි ඇවිල්ලා ඒ අපහසුතාවය නැති කර පඩිපෙල නැගින එක නතර කරලා විනාඩි 2-3ක් ගියා. ඇවිදින එක නතර කරලා විනාඩි 2-3ක් ගියා. තරහ යන එක පොඩ්ඩක් අඩු කරගත්තා. අන්න පේන එක නැති වුණා. මෙන්න මේ ස්වභාවය තමයි හරියටම ස්ටේබල් ඇන්ජයිනා කියලා කියන්නේ. මේ தත්ත්වය දැක්ක ගමන් අනිවාර්යයෙන්ම මේ රෝගියෙක් කළ යුතු දේ තමයි වෛද්‍යවරයෙක් වෙත යන්න. වෛද්‍යවරයෙක් වෙත ගිහින් ඉවර වෙලා බය නැතුව කියන්නේ මට තියෙන ස්ටේබල් ඇන්ජයිනා. yes I know that. එතකොට මේ වෛද්‍යවරයා මෙයාව මැනේජ් කරන්නේ පළවෙනිවටම බෙහෙත් වලින්. ඒකයි තේරුම් ගන්න. බෙහෙත් වලින් මැනේජ් කරලා මේ රෝගියාව සෑහෙන කාලයක් මේ ස්ටේබල් ඇන්ජයිනා ස්වභාවය තොර කරලා ඒ කියන්නේ සාමාන්‍ය quality of life මැනේජ් කරන්න පුළුවන් බෙහෙත් පමණක් බිලි. එහෙම නොකළොත් සමහර වෙලාවට සමහර රෝගීන් කල්පනා කරනවා නෑ මට මේක වැඩි ආරක්ෂාවට. මම මේකට ස්ටෙන්ට් එකක් දාගන්නවා කියලා. එහෙම නැත්නම් සමහරලාට දැන් ડોක්ටර් කිව්වේ ඉන්දියාවේ යම් ප්‍රදේශයක අනවශ්‍ය පරිදි 500 stents 500,000 stents කියන්නේ ලක්ෂ 5ක් ඒ ප්‍රදේශයේ අනවශ්‍ය ලෙස ස්ටේබල් ඇන්ජිනා රෝගීන්ට අතුල් කරලා දෙනවා මේ වෛද්‍යවරු. එතකොට රෝගියා මේක දන්නවනම් Taman දන්නවා මට මේක මේ වෙලාවේ ස්ටෙන්ට් එකක් දාගන්න ඕන එකක් නෙවෙයි කියන එක රෝගියා දන්නවා. එතකොට වෛද්‍යවරයා එහෙම සජෙස් කරන්නේ නැහැ, රෝගියා ඉල්ලන්නේ නැහැ. ලස්සනට බෙහෙත් ටික අරගෙන ඉන්නවා. එතකොට මේක තව රෝගීන්ට කළ හැකි දෙයක් ડોක්ටර් රාමසාමි කියනවා සෝබිට්‍රේට් ටැබ්ලට් එක. අපි දිවයට තියෙන හෘද පපුවට වේදනාව වෙනකොට දිවයට තියෙන ටැබ්ලට් එකක් තියෙනවා. එහෙම නැත්නම් දිවයට ගහන ස්ප්‍රේ එකක් තියෙනවා. එතන මේ වගේ චෙස්ට් පේන් එකක් කියන කෙනෙක් ළඟ ඒ ටැබ්ලට් එකක් තිබුණාට කමන්නේ. ඒ ටැබ්ලට් එක දිවයට තියාගත්තාම මේ චෙස්ට් පේන් එක යනවා. හැබැයි මේ චෙස්ට් පේන් එක ආවයින් පස්සේ ඒ දෙන වෛද්‍ය ප්‍රතිකාර හරියටම ෆලෝ නොකළොත් ඊළඟ අදියරේදී අර විනාඩි දෙකෙන් යන පේන් එක විනාඩි 10ක් 20ක් 30ක් එන්න පටන් ගන්නවා. එතකොට වැඩේ බයන්න. ඒක නිසා අර මුලින් විනාඩියක් දෙකක් යනකොට හම්බ වෙන මෙඩිකල් මැනේජ්මන්ට් එක ඒ කියන්නේ ඖෂධ වලින් කරන කළමනාකරණය හරියටම කරන්න. හරියටම කරලා ඉවර වෙලා ඊට පස්සේ එහෙම කළොත් අර ඒ ස්ටේබල් ඇන්ජයිනා කන්ඩිෂන් එකෙන් අන්ස්ටේබල් අස්ථායී ඇන්ජයිනා කන්ඩිෂන් එකට යන්නේකට ගොඩාක් කල් යනවා. ඒතර මේ කල් ගියාම තමයි ජීවිතේ ජීවත් වෙන්න තියෙන කාලය වැඩි වෙනවා. ඊට පස්සේ එතනින් එහාට අන්ස්ටේබල් ඇන්ජයිනා කන්ඩිෂන් එකට ආවයින් පස්සේ හොරිසොන්ටලි ඒ කියන්නේ තිරස්සතට රෝගේ හොස්පිටල් එකකට ඇඩ්මිට් වුණොත් එතෙන්දී අනිවාර්යයෙන්ම ස්ටෙන්ට් එකක් දැමීම හෝ ඊට පස්සේ එහෙම නැත්නම් බයිපාස් සර්ජරි එකට යෑම අනිවාර්යම වෙනවා. ඒක කළ යුතුම වෙනවා ජීවිතේ බේරගන්න නැත්නම් වෙන කරන්න දෙයක් නැහැ. ඒක නිසා අන්ස්ටේබල් නම් තමන්ගේ ඇන්ජයිනා කන්ඩිෂන් එක. ඒ කියන්නේ එක දිගටම අර දිවයට තියෙන සෝබිට්‍රේට් ටැබ්ලට් එක තිබ්බත් දවසට 10 පාරක් විතර එනවා. ආයි පේන එක එනවා ආයි නැති වෙනවා. ඒ වෙනකොට ඔයගොල්ලෝ තේරුම් ගන්න ඕනේ රෝගියා දැන් තව බොහොම දැන් මෙච්චර සිග්නල් දුන්නා heart එක ඔයාට heart attack එකක් එන්න හදනවා කියලා ගණන් ගත්තේ නැහැ. දැන් ඊළඟ මොහොතේ එක්ක heart attack එකක් එක්ක death එකක් කියන එක රෝගියා පැහැදිලිව තේරුම් ගන්නවා. මේක රෝගියා කල යුතුමයි. එතකොට හරි අඩුතරමේ ඉක්මනට හොස්පිටල් එකට ඇඩ්මිට් වෙලා තමන් ස්ටෙන්ට් එකක් දාගන්න එක හරි එහෙම නැත්නම් බයිපාස් එක කරන හරි තමන්ගේ ජීවිතය බේරා ගන්න අවශ්‍ය නම් ඒ දේ කළ යුතුම වෙනවා. මෙන්න මේක තමයි ડોક્ટર රාමසාමි පැහැදිලිවම ස්ටේබල් ඇන්ජයිනා සහ අන්ස්ටේබල් ඇන්ජයිනා පිළිබඳව කරන විදිහ.
Thank you, Dr. Ishanta. That was a very good explanation.